Fanny. So, Mr. Brady?
Great. Thank you, Madam Chairwoman Slaughter, Ranking Member Dreyer, distinguished members of the committee. I've introduced 10 amendments to this legislation. With your permission, I'll testify on one of them tonight.
All right.
The 10 amendments, just so you know, are designed to protect seniors from health care rationing, to make sure cancer patients don't get stuck with substandard care in the government-run public plan, and to provide the public with information about wait times in the government-run health insurance exchange. Another amendment would freeze new taxes under the bill for states with very high unemployment rates. That amendment also requires the government to certify that tax increases contained in this bill won't hurt small business jobs or cause existing jobs to be outsourced overseas. Obviously, with a 10.2% unemployment rate, it's important this bill not cost job losses. The amendment I would like to testify on today would block cuts to the Medicare program contained in this bill unless the Secretary of Health and Human Services certifies that implementation of the cuts would not result in rationing health care, would not result in reduced health care services for our seniors, would not result in longer patient wait times for the elderly, or the reduced availability of health care providers participating in the Medicare program. This amendment is so important because the Democrat bill today contains more than $500 billion in cuts to our seniors. These $500 billion of cuts would affect our hospitals, our skilled nursing facilities. It would slash money to hospice cares, which seniors use in the last few days of their life. Cuts to clinical laboratories and durable medical equipment. It affects nearly every senior in a serious way. This amendment would ensure that we don't sacrifice our seniors' health care to create a new unsustainable entitlement program. Before we make any of these $500 billion of cuts to Medicare outlined in this bill, cuts that will certainly be felt by our seniors, my amendment would simply require that the HHS certify we're not rationing our seniors' care. Seniors are, I will tell you, over August, September, I held 53 town hall meetings, healthcare roundtables. Seniors are scared. Seniors know that when the government cuts reimbursements to doctors, there are fewer doctors to see them. When they cut reimbursements to hospitals, there are fewer hospitals, especially in rural areas. They know when you cut home health care, the visits stop. And they know intuitively that when the money runs out, senior care gets rationed and they are damaged. So I think earlier tonight, a number of members said that this bill will not ration cuts to our seniors, would not cut Medicare Advantage plans, would not force seniors out of that plan. I know in Texas, 660,000 seniors will likely be forced out of their plan. This makes sure that health care is not rationed to the elderly, the most vulnerable, the most scared among our population.